Ashok Kapoor, CEO and founder of Hawkeye MedTech. Did you know 80% of physicians are working at capacity and 75% of physicians feel overwhelmed and frustrated? Meet Dr. Ross. Dr. Ross is a primary care provider that starts his day at 8 o'clock in the morning, sees the first patient at 8:30, and works continuously. And he even works during lunchtime trying to catch up on paperwork and catch up on patients. And the last patient he sees is at 6 o'clock, and by the time he gets home, it's 8 p.m. His children are ready to go to bed and missed out most of the family events. During COVID, he started using a telemedicine solution, and it helped him where the patients didn't have to come to the office anymore. But again, he could not get himself out of the office to be able to do remote visits from home. Then he learned about TotalCare, a unique telehealth platform that is feature-rich and allows him to be able to work from home and be able to do many of the calls from home. So now he's able to take a few calls in the morning, and he gets to the office at 10 o'clock, so he's able to enjoy his breakfast with his spouse. And then he's able to get home in the evenings around 6 o'clock, still have some quality time with his children, and he can go to the office and take a few calls from there. TotalCare is self-service. There is no third party or a receptionist involved where the patient makes an appointment, provider accepts it, and patient can also attach lab reports, MRIs, X-rays, and all the information that Dr. Ross needs to be able to get on the call with the patient. And one of the things he really likes is the care coordination feature of TotalCare, where all patient call history moves with the patient from provider to provider. So when he sees Miss Jones, he's able to see in there that she saw a cardiologist last week, and he's able to get into a conversation what the cardiologist said. Another thing he really likes is Miss Jones is diabetic, so he can assign tasks to her. For example, he can assign her tasks to check her blood sugar twice a day, and application tracks it, and he's able to see a patient dashboard, find Miss Jones, and be able to track longitudinal data for her diabetes parameters and be able to help her manage her chronic diseases so much better than having to check the blood sugar once a day or give her a piece of paper to write her blood sugar on a regular basis that she either loses the piece of paper or writes it on 5 or 6 pieces of paper. Makes very cumbersome. So TotalCare has helped Dr. Ross have a good family work balance and be able to add additional revenue by charging remote patient monitoring, get his MIPS bonuses, and get a satisfaction that he's able to help his patients manage their chronic conditions so much better.